Good morning. A few days ago I posted on my comments section of my YouTube channel a question for you, and that was, what percentage of the total number of cancers present in the population today do you think is preventable, is caused by preventable factors? And I gave you several options from 10% all the way to 60% or more. And interestingly enough, almost 60% of the close to 500 people who voted on this so far were convinced that 60% of cancers are preventable. So that's very encouraging for someone like me who likes to work in health education and health awareness and lifestyle awareness on what the impact of what we do, what we eat, what we take in terms of the risk of chronic disease. And so today I wanted to delve a little bit into this issue of preventable causes of cancer, and specifically I'm going to address the top two of them, the top one and the second one, and I grouped them together for a reason. One of the ways to look at that is to look into the literature. In fact, if you go historically back in time to the literature that first identified the preventable causes of cancer, we can go all the way up to 1981 in this study published in the Journal of the National Cancer Institute in the UK, in Great Britain, where famous epidemiologists, a couple of them actually, Richard Dole and Richard Peto, published this famous article, The Causes of Cancer, Quantitative Estimates of Avoidable Risk of Cancer in the United States Today. That was in 1981. And this was a work that was commissioned by the US Congress at the time. There's a whole story about it. We don't have time to go into it today. But their assessment at that time was that about 30% of cancers were attributable directly to smoking, to the habit of smoking. And if you look today, and I chose to go to the UK because that's where I found an article that is recent, this one here in 2015, if I'm not mistaken, so a few years ago, the estimates were that about 20%, 19.4% of total cancers were caused by smoking. And so you can see there's some variation here depending on how many people in a particular place or country smoke. In the United States and in the UK, also most of the Western world for that matter, since 1980s until now, almost half of the people who smoked don't smoke anymore. So that has been an improvement and accounts for this drop here. In other places, I know in Romania, for example, and many other places around China, for example, the actual number of cancer-related deaths related to smoking, that is, have been on an increase because more and more people smoke, or the decline in number of people who smoke has been very modest, if any at all. And I don't have to spend a huge amount of time telling you that smoking is bad, that it causes lung cancer. It's common knowledge. You just have to do it. And yes, it's very hard to quit smoking, but it can be done. So if you do smoke, talk to your doctor, look for resources. They are there. You can do it, and it has to be done. We know, for example, that people who quit smoking before their 30th anniversary can prevent over 90% of lung cancer related to smoking. And if you quit smoking by 40, you prevent 80% of those cancers. So yes, you have a lot to gain. Even later on in life, there is gain to be made by quitting smoking. Today, however, I wanted to focus a little bit more on this fourth factor here, which says alcohol. About 4% of all cancers, 4% of all cancers in general are attributable to alcohol consumption. And this is important because a lot of people, I see patients almost every day, and when we take them history as a new patient or we revisit it, they say, well, I take a glass of wine or two, most evenings because it's good for my heart, right? They have been told that in the media, doctors even say that often, and they do it. And some people who didn't even enjoy alcohol, they do it just because of the health benefit. Well, I'm going to be a contrarian today. There was a guy on my channel a while ago who said, "Oh, Dr. Gily, I'm waiting for you to become one day a contrarian. When is that going to happen?" I said, "Listen, that's not going to likely happen where I start to speak against the COVID-19 vaccine, but wait for it because it will happen." So today is such a day, so bear with me. If you use alcohol for health, for relaxation, for enjoyment with friends, or whatever the reason might be, just bear with me. I do have a contrarian message to convey to you. I'm going to do it gently. I'm going to stick to the facts and not bring up all kinds of external issues. But this is important and it needs to be told. It's a story that is never almost told. I bet you that the majority of you, unless you work in the field, have no idea of what I'm going to show you here. And that is, for every 10 grams of alcohol, watch this, every 10 grams of alcohol a day, the risk of these cancers, and this is the partial list, I'll show you other cancers in a moment that are related to alcohol intake, but it has been quantified better for breast cancer. Every 10 grams of alcohol per day increases the risk of breast cancer by 5% in the premenopausal women and by 9% in the postmenopausal women. Now, what is that 10 grams of alcohol, you may wonder? Well, a standard drink here in the United States has approximately 14 grams of alcohol, so almost 1.5 the amount mentioned here. A standard drink is basically a 12-ounce glass of beer or a glass of wine or a tiny, tiny glass of whiskey or vodka or strong liquor like that. So, and the other thing is, a lot of times people are advised, if you are a male, 2 drinks a day is okay. If you are a female, 1 drink a day is okay, and in fact is good for you. So you can see here, with 1 drink, we already go 1.5 this much risk for these cancers. I also listed here basal cell and squamous cell carcinomas, which are skin cancers. Interestingly enough, you drink alcohol and your risk of skin cancer goes up by 7 to 11%. So this is major. This is something that I bet a lot of you had no idea. There are studies documented this. If you guys wanted to get into the details of that, I will. But this is a reality. And so what I do when I talk to patients, I said, listen, it's your choice. You do with your body whatever you think, but you have to know this. You only know the narrative that is good for your heart. There's a lot of other things that are much better for your heart. Your heart does not have a deficit of alcohol. Your body does not have a lack or a deficit of alcohol. You don't need it. It's toxic for you. And this is why, one of the reasons, because there are many. And that is, you don't need, whoever in their right mind will drink every day something, knowing that their risk of breast cancer goes up by 5 or 10%, or their risk of skin cancer does the same thing. I mean, think about that, right? It's kind of ridiculous. And yet we do it. A lot of people do it, and they partly because they don't know. And so my purpose here, being a contrarian, no, really, is to make you aware of that. Other than those 2 or 3 types of cancer, though, anywhere alcohol goes into the GI tract, from the mouth to the throat, to the voice box, to the esophagus, stomach, liver, it can, and even in the colon and rectum, it will increase the risk of cancer. But like so, it does it in the breast. And in fact, in countries like Romania, where drinking is much more prevalent, heavy drinking that is, than here, you have a lot of people ending up with liver cirrhosis and then liver cancer from the alcohol. So it's a major issue. It's the leading cause of liver cancer in many parts of the world. Again, something that a lot of people don't realize. A couple of other pieces of data that I think will underline what I have been saying so far, and that is in the United States, because the other part of this is this. People say, Doc, my risk of cancer is low. I don't worry about the 5% increase. I'm not a female, so risk of breast cancer is not an issue for me. Although breast cancer happens in men too, it's just much more rare. But people say, I'm drinking moderately, a drink or 2 a day with friends, what's the big deal here, Even the Bible says it's okay to drink, although that's a separate discussion that we can have. I don't agree with that, but people make the Bible say that sometimes. Anyways, they say, what's the big deal? Well, the other big deal is this, and I've been I've been personally touched by family members in my family who fell victim to this. So I have an axe a little bit to grind here, and that is, we know from data that's pretty solid that 1 in 3 adults in the United States today is an excessive drinker. That is, 1 in 3 people drink too much. Too much. Not just that little drink here and there, or little glass, half a glass of wine a day. They drink too much. And most of them actually binge drink. So they may drink only once or twice a week, but when they do so, they go 6 drinks, 12 drinks. They go until they get hammered, right? And then of those who binge drink, which is most of these guys, 10 to 30% are alcohol dependent. So there's a progression here from drinking moderately, where you don't have a problem with it, to where you become a binge drinker or drink excessively, and then you become a alcohol dependent. You become addicted. Alcohol takes over your life. I remember when I was growing up, I was in medical school in Romania, and my parents lived in a village, and so in the summertime I went home and I helped them out with things, but I also had to do a few weeks of medical practice in a hospital or in a clinic as part of my training. And so I went to the local hospital in the area, and there was a famous surgeon there close to retirement. He was doing surgeries for the whole valley there in the mountains where we lived. And he was known, he was famous that, yes, he was a good surgeon, but if you went as a patient, or if your kid went for appendicitis or something like that to have surgery, you better brought him a bottle of strong drink, alcoholic drink, because otherwise the popular knowledge was his hand would be too shaky and he can do a bad job at that surgery. So he had to drink before he could do the surgery properly. And that takes me to the next picture here, and that is, you know, when we look at people who have a problem, who drink too much, those 1 in 3 people in the US, we can divide them in these categories. And bear with me for a second here, because what happened here, the text of this thing got all over the place here. So we can divide them in these categories. You can have the largest slice in this pie that makes 100%. About a third of these folks, 32%, are young adults, 24 years of age on average, who binge drink. Basically, they get together on a weekend, they drink, they're in college, wherever they are with their friends, and they drink until they get drunk. And they do that, you know, periodically. So that's the largest group. So it's concerning, number one, because it's young people. Number two, because they binge drink. They really get into trouble when they do that. They can go and drive and get killed. But not only that, out of those binge drinkers, as I told you before, if you remember just in this last page here, up to a third of these binge drinkers become dependent, depending on other factors. Now, the next slice here is this one here, where 21% of, again, young antisocial persons, people who have trouble with socializing. It's an increasing slice of our population today. These guys are on average 26 years old, but they start drinking in their, like, when they are 15. That's when they discover that drinking alleviates some of their social anxiety and problems with socializing. And they also use other drugs like tobacco and pot and so forth. So this is a big slice, again, problem down the road here, because all, like, half, this makes more than 50%. Those two groups here make 53% of all the people who drink. And they are young people. You see where this is headed. Now, next slice over here, this functional middle-aged drinkers, they drink every other day. They do drink when they do drink. They don't stick to just 1 or 2 drinks. They drink 5 drinks or more, but every other day or so, they recover, they get a hangover the next day. But by and large, they're able to keep their job, function reasonably well, and unless you are intimate and they know their lifestyle or they confide in you, it's not easy to tell that they do drink the amount that they do. And I see these people all the time in my clinic. And then you have these guys who are considered 90% again, who are considered intermediate drinkers. These people have familial characteristics, you know, they have hereditary components. And I've had people in this category where they go as young people to a party or two, they drink, bam, they get addicted right there and then, and it rules their life from there on. And oftentimes they end up in this second category, severe alcoholism, mostly males, but not only, who 9% of people who are completely addicted. They can't function without a lot of alcohol day in and day out. Now, why do I tell you all of this stuff? It's not to depress you about the problem of drinking, although it is depressing. What I'm telling you these things is because I think this information is oftentimes missing from the larger narrative when you go to your doctor, when the media talks about these things, when in school even people discuss these issues. Again, I'd be curious to see if you've been aware that cancer is a big factor, alcohol is a big factor in breast cancer, for example. There's very few things that you can do to prevent breast cancer, although I made a video separately on this issue. I'll link to it, watch it, it's interesting if you are interested in that. But alcohol is one of the main preventable factors when it comes to breast cancer, and not only that you can do. In any case, I hope you will take these pieces of information in a balanced way. Think about it. If you have a problem with alcohol, seek help. There is help. You can get over it, and there is life besides and beyond alcohol. Personally, I only tried once and I didn't like it, fortunately. I was a child and I didn't even know that it was alcohol. Somebody tricked us into drinking a glass of strong drink, and it felt like burning my throat. So I never touched it, and I have no regrets about it. Absolutely zero. And I encourage you, if you have a problem with that, again, to seek help. Anyways, until next time, you stay healthy, stay away from tobacco and alcohol, and stay wise, my friend.